In my 20 plus years as a clinical psychologist, I've noticed a frustrating pattern for patients. So patients come to me with clear symptoms of emotional dysregulation, yet their previous doctors only used labels like anxiety, depression, or bipolar disorder. Let's look at 5 possible reasons doctors are reluctant to diagnose borderline personality disorder despite strong evidence for the diagnosis. So first is the stigma trap. Even in 2026, unfortunately, the BPD label carries an unfair weight. Many clinicians fear that by applying it, they are marking you. They worry that future medical providers like ER staff or surgeons will see that diagnosis and dismiss your physical pain as attention-seeking or psychosomatic, like it's all in your head. They believe it's a defensive move to protect you from a biased system, and sometimes they're not wrong. Second are the systemic barriers. So in the world of insurance coding, personality disorders are often classified as non-reimbursable. Don't understand it, never encountered it myself, but I've heard of this happening. What this means is that an insurance company might pay for a major depressive disorder session, but deny a BPD one. It's terribly unfair. So what doctors will do is they'll use a placeholder diagnosis to ensure that your care is covered, even when they know it doesn't tell the whole story. It's about getting you the right treatment. Third is diagnostic overlap. So BPD has similarities with C-PTSD, ADHD, and bipolar disorder, as we've previously discussed. Because there are 256 different ways to meet the criteria for BPD, many doctors feel safer staying in the mood disorder lane. They worry about misidentifying a trauma response as a personality trait, so they wait, sometimes for years. Fourth, and this is a hard truth, is clinical ignorance. So many practitioners simply don't understand what BPD actually is because they haven't been trained in the nuanced assessment of personality disorders. In a fast-paced medical environment, a provider might only spend 15, 20, 30 minutes with you if you're lucky. So when they hear mood swings, they often jump straight to a bipolar disorder diagnosis without digging deeper to see if those shifts are actually triggered by past trauma resurfacing in some way. So when a provider doesn't understand the underlying mechanism, they tend to avoid the BPD label entirely, simply out of a lack of competence. And finally, there's countertransference fear. So treating BPD requires the clinician to have a high level of self-mastery. Many therapists feel hijacked by the intensity of the emotional storms and the push-pull dynamics that a lot of people with BPD present with. So if a doctor hasn't done the work to manage their own reactions, or been trained in how to manage those things in other people, they may avoid the diagnosis because they don't feel equipped to sit in that CEO chair alongside you. We have to stop treating BPD as a character judgment. It's a biological pattern, a set of survival settings that can be updated. You aren't too difficult or too much. You're likely running high-performance hardware in a world that doesn't have the manual yet. Stop judging the feeling and start observing the data. And if I can help you with BPD symptoms, reach out to start a conversation about treatment, or check out my TikTok BPD skills training group. Just tap the subscription link in my TikTok profile to try it free for 7 days.